Welcome to Escaping Health Benefits Paternalism. We're going to be discussing the power, control, and choice of modern health benefits today. So as we start digging into that, before we do, I'll give a brief introduction of myself and OneBridge, and then we'll continue the conversation. So my name is Jason. I'm the Director of Business Development here at OneBridge Benefits. And at OneBridge, we're innovating healthcare, health insurance specifically, or health benefits. And one of the ways that we're doing that is through our newest product, YourWay Frontier. Now, we're going to tell you more about that, but first, let's start talking about health benefits paternalism. And it might sound like a big word, so why don't we break down what paternalism is? So it's the policy or practice on the part of people in positions of authority of restricting the freedom and responsibilities of those subordinate to them in the subordinate's supposed best interest. Okay, now that's a big word with a bunch of big words wrapped up in the definition. You might be thinking, how does any of this matter to health insurance or to the health benefits that I offer my employees? Well, health benefits are one of the few things that still exist in our financial relationship with employees that has a sense of paternalism to them. So health benefits, in some ways, we do restrict the freedom of our employees to pick the plan that best suits them, because most employers throughout the country, 90%, offer 2 plans or less to their people. Even if we offer way above average, say we double the average and we offer 4, that's still 4 plans for a population of people that may be in the hundreds. So 4 plans for hundreds of people. Now, it's been done that way for a long time, so it might seem like that's the best way to do it. But fortunately, things are changing. And many employees don't necessarily feel the responsibility around benefits because we've been doing benefits for them for so long. And of course, we do assume that what we're doing is in their best interest. We're helping pick the plans that would best fit our employee population. But maybe there's a different way. So let's talk about the current model just a little bit. So right now, we all have these great intentions of providing health benefits for our team and providing for the health of our teams. But the design is a little bit off in the level of paternalism that it brings to the table. So within the current design, why do we, the employer, buy a health insurance plan and have our employees onboard onto it? Or maybe we sponsor a plan and our employees onboard onto it. Health in general is very personal. And the decision of how to protect our health is also very personal. So why, as employers, are we making that decision on behalf of our employees? Even if we're picking 2, 3, 4 plans for our employees, in many ways, we're still making that decision for them. And I know that if your life is anything like mine or anything like anybody else's in an HR, CFO, CEO type of role, you come into work every day and you've got a lot to do, and then somebody throws this on your plate. And these are all the ways that you have to take care of your employees and their related benefits. So you have to go out to the market and select the 1 or 2 health plans that are supposed to fit the entire team. But I'll say, and I think that you already know this, the plans don't always fit everyone well. And we'll talk a little bit more about that. But it's kind of like, the first day of work, somebody comes in and they get a suit coat for your organization, but it's a one-size-fits-all suit coat. Or maybe there's 2 sizes. Well, there's going to be a lot of people walking around the organization looking like Tommy Boy or looking like the person wearing a suit dress. And it just doesn't fit everyone. Our health benefits are very much the same way. You're the one stuck handling all of the QLEs. You're finding solutions for your out-of-area employees. You have to stay up to date on group health regulations. And if you move over to the left side, you're also the one that has to communicate the rate increases to your employees annually. It's either you're taking the hit out of, you're paying the extra when the rates go up, or you're letting employees know that they're going to be getting more taken out of their paycheck and they're going to be taking less money home for their families. Why do you have to be the one to communicate that? Well, it's because of the current paternalistic model of group health benefits. You own the plan. Your employees are just onboarding onto it. You sponsor the plan, and your employees are just onboarding onto it. So You have COBRA administration as a result. You have ACA reporting as a result. You, in many cases, are answering employee questions about health insurance, but you don't necessarily have to be a health insurance professional. When you signed up for your role, you may not have signed up to be the on-site health insurance professional. In a lot of cases, you really shouldn't even have to do that. There's so much more that you could be doing if your employees owned their own health benefits. Let's keep talking along this line a little bit. So one of the things we did is we surveyed employers, surveyed HR benefits managers, CEOs, CFOs, and we asked them, how does the current state of group health benefits make you feel? How does the current state of group health benefits paternalism make you feel? These were some of the answers that we got. People said they felt limited. That was generally around the number of plans that they could pick for their people. They felt overwhelmed. They felt like it was overly complex. They felt the employee dissatisfaction. And that employee dissatisfaction generally also came around the number of plans that they had available to them. And then anxiety came up a bunch. The word anxious came up a bunch. It almost sounds like too big of a word to use in the context of health benefits, but it came up when we started talking about the rate increases annually and just how unpredictable those rate increases are. One year your premiums might come in flat, the next year they might come in 20% higher. And it's all because of this current paternalistic model of group health benefits. So let's pull back just a little bit. I want to take a minute and introduce you to OneBridge. So at OneBridge Benefits, we're a company born and raised in Buffalo, New York. We've been innovating health benefits since our founding. We've done that largely through a benefit called a funded HRA. Now, that's a benefit where employers give their employees money into these HRA accounts, and for all intents and purposes, it becomes the employee's money. They can use it for any qualified medical expense throughout the course of their life. And there's a number of different ways that we can structure those accounts. But those funded HRA accounts, there's an avenue for the employer to give their employees money, and the employees use that money for qualified medical expenses. Now, we've been able to build a really strong business around these funded HRA accounts to date. We have about $2 billion under management. We work with over 1,300 employers, and we have over 230,000 lives on our platform to date. And since then, we've also rolled out other accompanying benefits like an FSA. But in 2020, the regulations changed around these HRAs in a great way. They allowed these HRAs to also be used to purchase individual coverage insurance and allow employers to make an affordable offer to their teams within an HRA and satisfy the ACA mandate, thereby bringing about an entirely new model of group health benefits. So now what we have is the intentions that you have as an employer to provide for your people and the design of the plan, the design of the model aligned around the employees, giving you the control that you need and the employees the choice that they need. So here's how the new model works. It's much simpler than what you saw before in that long list of paperwork and responsibilities. Now, your responsibilities come down to two things. You put money into your employees' benefit accounts, and your employees use that money to buy their own health insurance. And of course, we can set this up so that your employees have to use that money to purchase health insurance or have to purchase health insurance to qualify to receive those funds. But all you do now is you put money into your employees' benefit accounts, your employees use that money to buy their own health insurance. And of course, OneBridge Benefits is going to administer everything, and we'll guide your employees along the way. So when I say we're going to administer everything, we're going to take care of your 1094 data, 1095 reporting. We'll pay your PCORI fee. We're going to do all of your COBRA administration as it relates to these plans. We're going to take that long list of responsibilities you saw before. We're going to take care of that. The QLEs will handle. Employee questions about their health insurance, we're going to handle. So benefits in a large way gets removed from your plate because the paternalistic model of group health benefits is being put to the wayside. Now you're putting your employees in control of their own choice. And of course, we're going to guide your employees along the way, because if all we did was allow you to just throw a pile of money at your employees and say, hey, go out to the market in Western New York, you can choose between 66 different plans, have at it, I don't think we'd be doing the right thing for our teams. So we have a team of people that we'll talk more about in a minute that are going to guide your employees along the way. They're going to be guiding your employees through the plan selection process so that they can get the tailor fit benefits for themselves and for their household that they need. And of course, with it throughout Western New York, throughout New York State, we are going to make all the regional carriers available to each employee. Now, there's more to this, and it gets really interesting. So for you, yes, your job gets a lot simpler, and you're able to provide a much stronger benefit for your employees. But as much as it may not sound perfect to say this, we didn't design this benefit for you. We designed it for your employees. So now each employee is going to be able to get the tailor fit coverage that they need. So they can pick any plan on the individual marketplace that best fits them and best fits their household. So say that you have a husband and wife, we can actually get the husband one plan, the spouse another plan. We can even get different plans for different people in the household. So we're going to be able to get each employee tailor fit coverage. We'll talk more about that. Each employee is also going to have the ability to save for future health insurance expenses. So I'll give you an example, and again, we'll expound on this. You give your employee $500 to spend on their health insurance. They buy a plan that costs $350. They save that leftover money month over month, year over year, and they even take it with them if they leave. Now, that's a really important piece to this new benefit offering, because if you don't offer your employees the ability to save that leftover money, they're just going to buy up to the amount that you give them. So without the savings component, the employees don't really have the full range of choice that this new benefit can provide. So having that ability to save for future health insurance expenses is key to not only strengthening your benefit, but to unlocking the full value of choice that Frontier provides your employees. And also the benefit's portable. So of course, those saved up funds that they have month over month, year over year, those will go with them if they were to ever separate. And we can set up vesting if that's something you're interested in. But the actual insurance plan leaves with them as well. So the employee goes out, they buy their own insurance. They own their own insurance now. You no longer sponsor a plan or own a plan that they onboard onto. The employee owns their own health insurance. You're just paying for it, kind of like everything else in their life. You give them money, they buy stuff. You give your employees money, they buy a house. You give your employees money, they buy a car. You give your employees money, they buy their home insurance and their auto insurance. Now, you give your employees money, they buy their benefits, and if they were to ever leave employment, the benefit leaves with them. Okay, let's talk about how this thing worked in action. So we've been onboarding Western New York employers and employers throughout New York State onto Frontier for a little while now. So let me tell you a little bit about how people use this benefit, how employees were using this benefit. So your under 30 crowd, you may find the same thing. Most of them don't really utilize their health care that often. So they were happy to select either a catastrophic or a bronze plan, a good contingent of them. Now, of course, there were still people that were more risk averse in that under 30 crowd that said, hey, I still want my gold plan, or maybe I want a platinum plan still. But we saw a lot of this under 30 crowd taking these catastrophic or bronze plans and walking out of the meetings with our enrollers feeling like they got a raise, because maybe they're getting that $500 and they're only spending, if they're picking up a low cost bronze plan, maybe $350 on that bronze plan. And they're saving $150 every month. And that's piling up until a point in life where they need it, or until they have some sort of out-of-pocket medical expense, whatever it might be. They're saving that money up month over month, year over year. And then we have the 30 to 64 crowd. Now that obviously huge age range probably encompasses the majority of your employee demographics. We saw extreme tailor fitting within that group. People were tailor fitting the benefit to their specific health needs and maximizing the benefit dollars provided by their employers. So say that maybe you have that person that's under 30 and they've been saving up money in their funded HRA account for the past 3, 4, 5 years, and then they hit 30, 35, and we'll show an example of this in the next slide. They hit 30, 35, and they want to buy a higher cost plan. Maybe their health needs change, and they have all that money saved up. They can use that saved up money for any out-of-pocket portion of their individual premium that may not be covered by their employer. We'll cover that more in just a minute. The other demographic is the over 65 crowd. Now, everybody over 65 or older is selecting Medicare plans. These are generally very high quality plans, and the employees were really happy to take advantage of the Medicare plan. And what they were even happier about was that they'd be saving up a significant amount of money every month that they know they're going to be using as soon as they hit retirement, because they can use that saved up money to pay for their Medicare after they leave employment or after they retire. And just to highlight a little bit of how much employees embraced choice, in the average subset of 100 employees, we saw over 30 plans chosen. So some people may feel like, well, choice can be overwhelming, right? But when you provide employees with the right resources, specifically individuals, professionals, to sit down one-on-one with them and walk them through their decision, they ended up really embracing choice. And I'll highlight just how much employees appreciated that choice in just a moment. But first, let's take a look at what the dollars and cents look like in action. So we'll take a sample employee, Alex. When Alex came to work for us, she was 26. She selected a catastrophic plan because she didn't go to the doctor. Said, I never really go to the doctor. I have no significant health needs. I'm going to take a catastrophic plan. So the premium in Western Europe for a catastrophic plan in 2022 is $146. Now, the employer was providing $445 a month. So Alex is saving $299 every month. Say that she sticks with that same plan for 5 years. She'll have saved up almost $18,000. And then maybe her health needs change later in life. Say by the time she's 35, her health needs change. Well, then she decides, I really want a platinum plan now. And the premium for the platinum plan is $630, which is $185 more than her employer's contribution of $445. So she's going to be coming out of pocket $185 a month. Well, while we do enable a premium-only plan so that when employees do need to come out of pocket to cover the balance of their premium, they can do so tax-free, Alex doesn't even have to worry about that because she has funds saved up in her HRA account that can be used to cover that gap. It's a really neat portion of the benefit and a really powerful piece of it as you look at the life-spanning aspect of this new model for health benefits. And then let's look at Alex once she turns 65. She's going to be going on Medicare. Say she gets her Part A and say she purchases her Part B for $170 a month. That same $445 contribution from her employee is going to net her $275 in savings each month. And she stays working until she's 70. So then she's saved up $16,500 in her HRA account that she can use for her future Medicare expenses, any future qualified medical expense. Now that could be things like long-term care insurance. She can use it for glasses. She can use it for dental and vision coverage. There's a whole list of qualified medical expenses that she can use that money for, that she will most certainly be using that money for throughout the course of her retirement. Now, let me talk to you a little bit about the employee experience when it comes to onboarding Frontier. So we've put together a team of individual enrollment professionals. We call it our white glove enrollment team, our concierge service. So for each employee, we like to sit down one-on-one with each employee the first time that they're making this decision, first time they're picking their health insurance plans from the individual market. And I had the opportunity to sit down with employees before they went into the meetings with our white glove enrollment team. I wanted to hear what they were thinking about this new benefit. I wanted to hear some of how they were thinking about it, what they thought of it. And I've got to be honest with you, there was a healthy amount of skepticism there. People came into the meeting and they just weren't so sure about it. They felt like, I don't know what to choose. There's a lot of choices. I don't know about this new benefit. There was a healthy level of skepticism heading into the meeting with our white glove enrollment team. Then they went into the meeting And our white glove enrollment team is asking them questions like, hey, tell me about your health needs. Tell me about the medications that you're on. Tell me what doctors you're visiting. Tell me about known upcoming medical procedures or medical needs. And through that conversation, the white glove enrollment team is helping them pick a plan perfectly tailored to them and to that employee and their household needs. On the other side of that meeting, I was sitting down with those same employees again and asking them, okay, what do you think of the new benefit now? And over and over and over again, we got the same answer. We got, that was so easy. That was so easy. That was so easy. And just to make sure that we weren't just soliciting right after the moment feedback and just hearing what we wanted to hear, we conducted a survey afterwards of all the employees. And on that survey, we got a 9 out of 10 post-enrollment satisfaction score, which to me tells me two things. One, we've still got some room to improve. We've still got some work to do to get that 10th star. But it also told me that we've created something exceptional. Because throughout our industry, throughout health benefits, if you were to ask employees after they enroll what their level of satisfaction is in their benefit offering, we're typically seeing scores of 3 out of 10 or 4 out of 10. So a 9 out of 10 is exceptional. So we conducted some quantitative and qualitative feedback. We asked for testimonials. Just tell us how it went. And we got some of the answers that you see below. But that white glove style concierge service is really what set this offering apart from what they were receiving before. Sure, they had access to all the plans in the individual market, and they had access to a whole new mechanism for saving for their future health insurance needs or health needs in general, medical expense needs. But having that person to walk them through the decision is what really made the difference. So let me just take you through two more quick things, and then we'll hang out and answer some questions. So let's just kind of recap some of this. So traditional benefits versus the new modern model of health benefits. So in the traditional model, we talked about all the administrative burdens that you have. In the new model, you're going to be offloading that administrative burden to OneBridge. In the traditional model, you manage your business risk year over year. Each year, you have the risk of a significant increase in your premium, completely unpredictable. With this new model, you remove that risk with a controlled situation. You're moving into a defined contribution model. You're giving your employees a certain amount of money each year, and your employees are using that money to go out and buy the insurance that they need. Again, just like everything else in life from a financial perspective. And right now, you might be constantly searching for talent. You might be trying to solve this problem of how do I go out and find the best talent? The competition for that has increased significantly over the last few years. This is another avenue to increasing employee retention and engagement. With this benefit, each of your employees are going to experience the full value of the benefit that you're providing, because you're no longer telling them, yes, hey, here's your salary, and we also provide benefits. You're telling them, hey, here's your salary, here's how much money you're getting for benefits, and even more so on this side, it's not just here's how much you're getting for benefits, it's here's how much you're getting for benefits, you get the choice of how you're going to spend that money. So it really brings about the total value of the benefits that you're providing, and your employees are going to feel that. So delivering total comp, or delivering a way to view and feel total comp, is real in this new modern benefits package. And instead of offering a one-size-fits-all benefit program, each employee is going to be going out and getting the tailor-fit coverage that they need. So, you might be asking, hey, this all sounds great. What do we do next? Now, my goal from the beginning of this was really just to introduce you to this new idea. But if you are saying, hey, I'd like to take a next step and explore this just a little bit further, the next step is we'd ask you to complete an analysis. What we'd ask you to do is give us a census. You just email us. We'll provide you with everything you need to complete that census. And we'll compare your current benefit offering, from a cost perspective. We'll compare your current benefit offering to what's available on the individual marketplace. And then we'll send you a proposal outlining the results of our analysis and outlining all of the other benefits that you get from Frontier. If you decide, hey, that all looks great, that's when we'll step into a phase of designing your plan. We'll introduce you to other members of the team. We'll give you a demo of our selection platform where your employees can go on and view all the plans that are available to them. And then we'll start introducing you to our onboarding and launch team. Okay, I've said a lot. I've walked you through a whole bunch. Now's a great time for a couple of questions.
Hi, Jason. Just a quick question with regards to some of the reporting, and I think you mentioned some of the reporting that your platform handles. Was one of those COBRA?
Great question. Yes, we will handle COBRA reporting for your organization. So while COBRA is not necessarily, like, COBRA kind of goes away with this new benefit because each employee owns their own health insurance plan, there's no reason for them to elect COBRA. But there is still a regulatory component to COBRA and sending out COBRA notifications to your employees at the point when they leave. And yes, we will handle all of that. That's not anything that you have to do anymore. And if it was something you were outsourcing before, that's an expense that can be taken off of your plate. A great question. Thank you. Any other questions? Okay, great. Hey, we're going to stop the recording now. I'm going to stay on for a little while. If any other questions do come up, happy to hang out and answer questions. But we'll stop the recording now, and we look forward to connecting with you after you've had a chance to review this. And of course, if you'd like to complete an analysis, we'd love to walk down that path with you.